13, problems of childhood. Healthcare providers who work with children must have an understanding of normal growth and development, as well as an awareness of each child's individual pace. Usually, around this stage, the problem is actually focused on the growth and development, right? Children must master skills that move them from complete dependence to independent functioning in only a few short years. Normal childhood development, you have growth development, right? Growth is the increase in physical size. Development is the enhanced ability in skills or functions. And children grow in cephalocaudal, which is head to tail direction, and proximal distal, which is from near to far pattern, right? And then growth is a continuing process. So what are common behavior problems in children? You're gonna have colic, consists of a set of behaviors that are seen in an otherwise healthy, well-fed child. What happens is that this child or the children with colic actually cries for a long period of time, sometimes even 3 hours every day for more than 3 weeks, okay? Longer than 3 hours every day. It's a little too much, okay? Um, Nobody knows the cause for colic. However, they believe sometimes if the baby or the child is actually fed a little too fast or is not burped properly, that could actually cause colic. Sometimes if the baby is actually not going well or the baby's GI is not going well with the milk product that we're giving them, that could cause colic also. All right. Then you have feeding disorders that range from either overeating or undereating, right? If you know some children that actually is going through this, like some of them would be, overeating, keep eating and eating and eating and eating, and then some of them would be very picky, I would say, like they would do like under eating, or what they would do, some children would do is like they would have this fixation on just maybe one type of meal. For example, chicken nuggets, right? Some children would actually not eat anything except chicken nuggets, which is actually going to put that patient like in undernutrition state, right? Because what are you gonna get in a chicken nuggets? Some problems also are with sleep and like night terrors, problems with falling asleep, and some nighttime awakenings. Another is the temper tantrums, which is a common expression or extreme expression of anger and frustration. This occurs in children between 1 and 4 years of age, and temper tantrums occur 50% to 80% of children in this age group. Some of them also will have this what we call breath holding spells. Where the child will actually hold their breath, right? For a few minutes to the point where they're actually going to pass out. Okay, breath holding spells. These occur from 6 months and can last until 5 years of age. Okay, box 13.2 talks about interventions for temper tantrums. Okay, so read through this box 13.2 so that you would know some interventions that we can use for preventing and controlling tantrums, and of course educating the patient after the tantrum. So box 13.2, very important. Okay. All right, the major mental health problems of childhood are grouped into 7 categories, and it is in table 13.3 in page 142. You have environmental problem, which is poverty, homelessness, child abuse, child neglect, violence, problems with parent-child interactions. Example is a primary caregiver dysfunction or parent-child conflict. Emotional problems like anxiety, depression, somatoform disorders like physical symptoms and emotional causes, post-traumatic stress disorders, behavioral problems like your attention deficit hyperactivity disorder or ADHD, disruptive behavior like conduct disorder, antisocial disorder, oppositional defiant disorder, compulsive computer use, and then eating or elimination problems, your anorexia, your bulimia, enuresis, which is bedwetting, and then encopresis, which is a repeated, usually voluntary passage of feces in inappropriate places. Then we have the developmental problems like intellectual disability, learning disorders, communication disorders, and pervasive developmental disorders like your autism, childhood disintegrative disorder, and schizophrenia. Okay, when a child demonstrates absence of growth and inability to or refusal to change or failure to achieve the developmental task of his or her group, mental health assistance should be sought. So again, one of the sample for your environmental problem is the poverty and homelessness, right? So along with this environmental problems, then mental health problems can actually result. Also abuse and neglect, right? Very common. Abuse is causing harm to or maltreating another, while neglect is not meeting a child's basic needs for food, clothing, shelter, love, and belonging. One of the most common parent-child problems is conflict. Okay, parents need to set limits, and once that limit is set, you have to enforce them and be consistent. Okay, in order for us to provide stability for the children to test their limits in a healthy ways. No child or parent escapes childhood without conflict. Primary caregiver dysfunction is what we call it when a parent is unable to meet the needs of a child. A disturbance in the parent child interaction exists. So we have to make sure that we support, we educate the parents, and help them actually with those more effective and appropriate child care skills. Most of the time, it's actually just something to do with the lack of knowledge of the parent on how to properly do some child care. So it's very important for us to be there, to be the support, and to be the educator. Aggressive intervention can improve the long-term outlook for the children of these parents. Emotional problems like your anxiety. Emotional problems occur on children when they cannot cope successfully with their situations. So for your infants and toddlers, they usually experience this separation anxiety. And then for those school age children, they actually have this school avoidance or their anxiety based school refusal. And then most children's bouts of anxiety are relieved when they receive reassurance and emotional support. If anxiety does not interfere with relations with family or friends or activities at school, the child is coping effectively. Then you have depression. Depression describes a symptom, an emotional state, and a clinical syndrome. So, what are clinical findings of depression? There will be a persistent state of that unhappiness that actually interferes with the daily living, with the day-to-day activities of the child. And then what are therapeutic interventions that we can do? Reduce the problems that's causing the depression. Is there should be a cause, right? There should be a trigger for this depression. So explore that, assess that, interview if you can. Then once you know the cause, then we can actually do something about it. And then provide the child with emotional support to cope effectively. Then you have somatoform disorder. These are signs and symptoms of illness without a traceable physical cause. Signs and symptoms of illness without a traceable physical cause. And this is common in school-age children. One example is that school-age children is going to complain of maybe headaches or nausea, vomiting, even pain or upset stomach. They will actually complain of these signs and symptoms, and it's real. But then when you actually get them checked, there is no traceable physical cause. We call it somatoform disorder. This is also caused by stress. So again, explore, right? Is there something that is actually causing the stress of this patient? Can we do something with the cause of the stress of this patient? Okay. Again, children with this disorder, somatoform disorder, need understanding and reassurance. Then you have post-traumatic stress disorder or PTSD. Just like an adult, there will be a traumatic events, okay? Traumatic events, then PTSD might follow. What happens here is that there will be flashbacks. Okay, there will be times where the child is actually reliving that traumatic event. Okay, and then treatment focuses on early recognition and emotionally supportive care. Children and violence. Acts of aggression are common in schools where children may be bullied or intimidated, and children may witness violence in the home and then adopt it when they go to school or they go out there in the society, as a method for them to actually like a coping mechanism, solving problems. If a child's conduct becomes inappropriate over time, a disruptive behavioral disorder may be diagnosed. And there's two types of your disruptive behavioral disorders: your ADHD and your conduct disorder. Conduct disorder is defiant of authority, right? I don't care if you're gonna tell teacher that I hit you, okay? Defiant of authority. They engage in aggressive actions toward other people, refuse to follow society's rules and norms, and violate the rights of others. Another box that we need to highlight is your box 13.3. Let's see really quick what page this is. This is page 146. These are warning signs of violence: loss of temper on a daily basis, frequent physical fighting, vandalism or damage to property, carries a weapon, announces threats or plans to hurt others, use of drugs and or alcohol, enjoys hurting animals, engages in risk-taking behaviors, details plans to commit acts of violence. All right, disruptive behavioral conduct disorder. Children with this disorder are defined of authority, like we just talked about. Early diagnosis is important so that we can actually do something about it and we can help the child to become productive members of society. Treatment involves providing a stable environment and consistently enforcing or setting limits. And then under your disruptive behavioral conduct disorder is your oppositional defiant disorder. This is a recurring pattern of disobedient, hostile behavior toward authority figures. The child will usually or frequently lose their tempers, argue with the adults, deliberately annoy other people, and refuse to compromise. Treatment includes family therapy that stresses the limit setting and consistency. Problems with eating and elimination. So you can have children who have problems with eating. They are defined as routinely failing to eat adequately, Causes can result from repeated unsuccessful attempts to feed an irritable infant. Some of them actually are serious, like your abuse and neglect, and then parental mental health problems. Treatment focuses on ruling out the cause. So try to see first about what's the cause of the problems with eating and elimination, and then try to actually um, deal with the cause. All right, and then pica is persistent eating of non-food items for longer than 1 month. Okay, often seen in children with mental retardation, developmental disorders, vitamin deficiencies, and mineral deficiencies. Pica, sometimes there will be child or children that will be eating clay, right, or dust, or um, whatever it is that is non-food items. And then you have rumination disorder, which is when the infant actually regurgitates and rechews the food. Malnutrition may occur because food is brought back to the mouth soon after it is eaten and then often disappears as the child grows older. Enuresis and encopresis. Enuresis is an involuntary urinary incontinence of a child that is 5 years of age or older. There will be primary, which is wetting the bed at night, or primary nocturnal. I'm sorry, primary nocturnal is wetting the bed at night. Diurnal enurism is daytime wetting, and then secondary is when the child actually achieve the bladder control and then loses it. Encopresis is repeated, usually voluntary passage of feces in inappropriate places in a child 4 years of age or older with no physical abnormalities. Mental retardation. Children are considered mentally retarded only if they have problems in general intellect and adaptive functioning. Those that have a score lower than 70 on IQ tests are diagnosed as mentally retarded. The most important measure is the child's adaptive functioning. We have to define how well the child copes with the demands of life. Learning disorder, you have your dyslexia and the ADHD. Dyslexia is when the child is actually having some problem with reading, and then your ADHD is when the child is actually having some problem with focusing. Children with learning disabilities, they often have low self-esteem and lack the social skills of other children. And then you have communication disorders, which is your phonologic disorder, expressive, and stuttering. Communication disorders may result from neurologic or other medical conditions, but the cause is often unknown. Phonologic disorder is failure to use speech sounds expected for his or her age group. Expressive language disorder is speaking at a rapid or slow rate with strange rhythms and word use. Stuttering is a pattern of speech in which sounds are repeated frequently. Pervasive developmental disorder. Autism, Rett syndrome, Asperger's syndrome, and childhood integrative disorder. Please know the difference between them. Children have difficulty with social interaction skills, communication skills, and learning are those that have pervasive developmental disorder. Autism is the disorder of communication, social interactions, and behavior. Rett syndrome is development of motor, language, and social problems and loss of previous skills. Asperger's is a long-lasting impairment in which social interactions with repeated patterns of behaviors, interests, and activities. Childhood disintegrative disorder is severe regression in many areas after 2 years of normal development. Regression, if you remember, is when a child actually achieves something like maybe a bladder control, bowel control, or they finally stop sucking the thumb, and then Regression is actually when they go into that state, maybe the patient is very anxious, then they will go into that regression and starts sucking their thumb again, starts wetting the bed again. Schizophrenia is a condition associated with disturbing thought patterns and a distorted reality. Signs and symptoms and behaviors of children with schizophrenia vary widely, and the most important thing for this one is the early recognition and treatment. Early recognition is treatment very important because schizophrenia is often a long-term disorder. Okay. Therapeutic actions. The primary goals of therapeutic interventions for children with mental health problems include early identification and treatment. Specific goals are developed for each child, and then meeting those intervention that we are actually focusing on, like meeting basic needs, providing opportunities, and encouraging self-care activities. And that is the summary of chapter 13.